So turning on your deepest abdominal muscle, known as your transverse abdominis, is one of the most important aspects to stopping back pain. This abdominal muscle wraps around the body and attaches into the back, actually activating the back muscles, taking pressure out of the spine and diverting it into the abdominal region. So the transverse abdominis is like a belt that wraps around it. Unfortunately though, for a lot of people this muscle may not work properly, or it may not activate at all. So what we're going to get you to do is place your hands on the bony part of your pelvis at the front here. So we're just going to get you to put your hand here on that bony part for me. Excellent. And what we're going to get you to do is we want you to imagine you're trying to prevent yourself from going to the toilet, so you're drawing in. So if you were in mid-flow and you needed to stop, so actually trying to stop yourself from going to the bathroom. Then just relax and then actually prevent it again, so drawing in and then relax and prevent it again and drawing in. Now what should happen is as you draw in, you should feel a band of tightness come across the front of your pelvis. Ideally, if you have your hands on both sides, just on the inside of the boniest part, as you turn it on, you'll feel that tightness kick in and then relax. And then turn it on and then relax. By turning it on from your pelvic floor, what that does is it prevents you from engaging your outer abdominal muscles, which can prevent that from working. It also means that you can keep breathing normally with the diaphragmatic breathing that we showed you earlier. So once again, you're lying on your back, placing both hands on your pelvis across the boniest part. If you find the boniest part of the front of the pelvis, just go on the inside of that. Then what we do is we imagine we're preventing ourselves from going to the toilet or drawing in through our pelvis, activating your pelvic floor. You'll feel the tightness across here and then relax. And then turn it on and relax. Now ideally, to prevent back pain, what we want to be able to do is train this muscle to work 24 hours a day, 7 days a week. This muscle is going to stabilize your spine and take pressure out of your back. So by laying in this position and doing this exercise, what you're doing is you're retraining it to activate, and you're actually helping reduce the pain by taking pressure out of your back. You should be able to do this exercise lying, seated and standing, and even when you're walking. And by simply doing this, what you're going to do is get greater support into your spine.